Knock, knock, knock. Hi, my name is Rachel and I'm your nurse today, and we're going to be doing a Foley catheter today. We're inserting one. I'm going to start with some hand hygiene here, okay? I'm going to provide some privacy for us, and I'm going to ask you your name and date of birth, okay? I'm checking the armband for name and date of birth. Great. Okay, you're Morgan Smith, 2/27/1990. Okay, and do you have any allergies at all? Okay, no allergies. Patient has no allergies, and they identified who they are. Okay, and now I'm going to be checking the environment, making sure it is safe, and it is. And I'm making sure the equipment's in proper working order, and it is. The bed is a proper height for proper body mechanics. And now I'm going to go and verify the doctor's order and gather the supplies. So I go and I gather my supplies and I verify the doctor's orders, the type of catheter, the gauge, everything. So, and now I'm going to be doing some patient education for my patient, telling them about the procedure, why we need it, how everything's going to go during the procedure, and any side effects or adverse effects that might occur and that they need to be aware of. And I'm taking my bath blanket here and I'm placing that over my patient, and I'm going to slide their bed linen down underneath it, okay, and I'm going to be gathering it and placing it at the end of the patient's bed, okay, and I have a designated trash area at the very end of the bed here, and I'm going to open my catheter pack, okay, oh, sorry. I'm not opening my catheter pack yet. I am going to be pulling my bath blanket up, and I'm exposing the perineal area, and I'm going to be cleaning the perineal area, and depending on the level of need, I might get 2 wash bins, one with soap, one without, and rinse and wash. I'm going to place a water absorbent pad underneath them, and I'm going to clean really well. I'm going to put my gloves on, and I'm going to take my washcloth, and I would clean the outer edge away from me first, then the outer edge of the meatus towards me on the back side of my hand, nearest me, downward strokes. Then I'm going to take the inside of my washcloth, turn inside out, and go in the middle where the meatus is to clean. Okay, put that in my soiled linen. My peri area is clean. I'm going to change this water resistant pad underneath and put a clean, dry one for the procedure. And I have done that. Okay, and now we're going to get my catheter pack. I'm going to open it, and I'm going to be placing it here and between the patient's leg, and I'm going to do the flap farthest away from my body. Okay, and then I'm doing the side flaps, being very careful just to touch the outer edge. Then I see my sterile gloves, okay, and I'm going to be opening my sterile gloves, being very careful just to touch the inside flaps and nothing but. Okay, so I take my sterile gloves, touch the inside of the cuff with my dominant hand, and I'm placing it through, not touching the outer edge. And then I'm going to go ahead and wiggle these fingers underneath the cuff and inside, not touching the outer edge, and then placing my hand in, not breaking sterility. Okay, inside of my package is sterile, so I can go ahead, take this and put it in my trash area. So I have my sterile gloves. Now I can get my drape here. I can get my drape, and I can grab the outer edge of it, and I can place it in between my patient's legs. Okay, now I have my supplies here, and I'm going to go ahead and get this ready. I'm going to take my iodine and pour it all over my cotton balls, put that in my trash area, take my lube, pour it out, put that in the trash area, and I'm going to take this tray here, and I'm going to place it right here for easier access, still in my sterile field. I take my syringe and I'm going to attach it to my catheter, but I'm not testing the balloon today. Okay, and I am going to now clean my perineal area, especially my meatus here. So I'm going to grab the labia here and pull back to expose the meatus. Okay, and I'm going to take one of my cotton balls and go outer edge of the meatus. Okay, downward stroke with my betadine cotton ball, and I'm not crossing my sterile field, and I'm placing it in my trash area. And then I'm going to grab another cotton ball and then go to the edge, right, that's on the side of me, go downward strokes. Okay, and I'm putting in my trash area. Then I'm going down through the middle here where the meatus is to clean with my betadine soaked cotton ball. And I'm going around my sterile field and then into my trash area. Okay, and we're done with that part, so I can put that away. And with my sterile hand, I'm going to take my catheter here, and I'm going to dip it inside my lubricant, lubricate the tip of it, and I'm going to, so for the sake of this video, my meatus is going to be, it's going to be right here, okay? And my patient is a little lower to the ground than it usually would be, so if my catheter touches the bottom of this, my drape right here, it'll be okay just for this video, but I'm telling you that normally this would not happen. So I'm placing my catheter in the meatus, going a few inches, and okay, and then a few inches at a time, and then I get urine. See urine flash. So then I'm going to advance another 1 to 2 inches. I'm going to hold it in place with my non-dominant hand. Okay, then I'm going to blow up my balloon right here. I'm blowing up my balloon, and then I'm going to take my syringe and I'm going to put it in my trash area, and I'm going to tape my catheter to the side of my patient's leg here, and I would use better tape. I would maybe use a chevron if I had to. For now, for this video, that will suffice, that tape. Okay, and now I'm going to take my bag, my catheter bag, and I'm going to secure that to the side of the bed below the patient's bladder here. Okay, and then I'm going to take my patient's gown and put it over them and take this drape out, gather my supplies and get rid of it. I can put it in my trash area, and I can take my patient's bed linen, and I can go ahead and put that over them again, and take out the bath blanket, and I can take out that chuck underneath them too. My water resistant pad. Put this in my dirty linen. Okay, and then I'm going to make sure my patient is safe and that their environment is safe, that they're comfortable. I'm going to check for patency of the catheter. I'm going to make sure the bed is low and locked, rails up, they have their call light within reach, and I'm going to make sure they don't need anything, and I'm going to thank them for their time, and I'm going to wash my hands per CDC guidelines, 20 seconds at least, and take the curtain away and leave them.